1 out of every 3 women has an abortion by the age of 45. 58% of them are in their 20s, meaning that they're my age, a little younger, or a little older. Imagine killing your own child before holding he or she. People with children can find this unimaginable. Others may not. People face decisions daily about their lives, but deciding a person's life before they are delivered is an unlawful, selfish act. The use of medicine or surgery to remove an embryo or fetus and the placenta from the uterus is the definition of an abortion. Most abortions are done within the first 3 months of pregnancy, though there are some done when induced for labor. Medical abortions use various medications to end a pregnancy. Risks of a medical abortion include incomplete abortion, meaning that the child may still be alive even though you had the medicine taken it orally or intravenously or taken it vaginally. Heavy bleeding, damage to the uterus, and infections. You should not have a medical abortion if you are over 9 weeks, have a high-risk uterine rupture, are diabetic, have uncontrolled high blood pressure, have a heart or blood vessel disease, liver problems, take anticoagulants or blood thinners such as Coumadin. The list goes on and on. Oral drugs such as mifepristone and misoprostol are the most common medications used to abort a child. Let's take an inside look on comments the Food and Drug Administration had to say about the mifepristone and misoprostol. Mifepristone is a drug that blocks a hormone called progesterone. Progesterone is needed in order for a pregnancy to continue. When mifepristone is used with misoprostol, it is used to end an early pregnancy. An early pregnancy meaning 49 days or less since your last menstrual period began. You must understand the seriousness of having a medical abortion. Since the approval of mifepristone in September of 2000, the FDA has been informed of 8 deaths in the U.S. due to serious infection after having a medical abortion with mifepristone and misoprostol. The FDA claims they do not know 100% if the drugs cause these deaths. Though these medications can cause serious infections, the FDA does not have specific information that they would use to recommend preventive antibiotics for the infections that these drugs may cause. If you're going to get an infection from something or have even a slightest chance, your primary care physician puts you on an antibiotic so that you do not get the infection or so you're not so prone to it. In this case, the FDA doesn't seem to think that that is something that should be mandatory when giving mifepristone and misoprostol. Next, we're going to talk about surgical abortion. Surgically having an abortion is different than a medical abortion. The purpose is the same, to end the pregnancy, but the procedure is different. Surgical abortion uses a vacuum to remove the fetus and placenta from the uterus. The risks of having a surgical abortion include damage to the womb or cervix, uterine perforation, excessive bleeding or hemorrhaging, infection of the uterus or fallopian tube, scarring of the inside of the uterus, reaction to the medicines, not doing it correctly could even cause you to need more surgery. Keep in mind, even though you have had an abortion, doesn't mean you can't get pregnant soon after. meaning don't try and go having sex with anybody right after. If you just had an abortion, that means you don't want to be pregnant, so you should be doing everything in your power to prevent yourself from getting pregnant again. If the procedure is done wrong, there are possibilities of never having a chance to give birth again. The last type of abortion I will talk about is labor-induced abortion. This takes place between 3 and 9 months, which is the second and third trimester of a pregnancy. Misoprostol is injected into the vagina. This induction abortion has the same feel of contractions as if they were giving birth to a child, which technically they are giving birth to a child, just one that is not living anymore, no longer breathing. Just like the medical and surgical abortion, there are many risks. The only risk different from medical and surgical abortion is that medicine can be injected into the mother's bloodstream. Remember, there are chances of the baby still being alive when born. Did you know 6 out of 10 women who have abortions already have a child? I find that quite interesting. If you can feed, bathe, and teach a child that you already have, what gives you the right to end a child's life? It was your mistake for not using protection. 3 out of 4 describe themselves as religiously affiliated. Did you know that Catholic women have abortions as much as non-Catholic women? Statistics also show out of 100 women, 36% are white, 30% are African American, 25% are Hispanic, and the other 9% are other ethnicities. Understand, many people who have abortions do it for a great reason, such as rape. Never get an abortion without the proper counseling. There may be ways around the abortion. Make sure you go see a counselor. Abortion needs to be banned for women who are doing this because they do not want to be pregnant. There are too many people who cannot have kids who would like to take care of all the aborted children. Give the children a chance. Sign this petition stating you are against abortion, that abortion is a way out for unthankful women. It is sad to see all these women that are able to have kids aborting them. Take a stand and sign this petition. Don't allow women to keep getting abortions because they made the mistake themselves of going out and getting pregnant. The petition is just for the women who go out and do it on their own. And for the women who get raped, this petition does not have to do with you. It's for all the other women who use the abortion as a way out. Thank you.